I hope you're doing well. It's been a little while. If you don't remember me, my name is Jessica Parham. I am in Nursing 102. I am with Miss Matthews right now in maternity. So, right now, I'm a little out of breath. I just got in from a dog walk. I'm sorry. So, I believe right now, I need to do postpartum assessments of the bubble. And then I also have C-section delivery incisional care and application of heat and cold with sitz, bath, and ice. So I don't know how they want us to do this if it's individual videos, so I'm hoping you can give me some feedback later. But I'm just going to go off the bubble and kind of fill in with that, and if it's good for all three, great. If not, please just tell me what I need to do for the other two to get signed off. So I do have my notes here that I've been studying off of. I'll leave them over there, but just in case I freeze, I don't want to screw up the video or leave something important out. So normally this would be great with you because we can go back and forth, but here goes nothing. So with Bubble, with the assessment for a postpartum woman, you want to first start looking at her breasts. So with the breasts, you're looking at a number of things. You were looking at the size, the asymmetry of them, if there's any redness, like any tenderness or swelling, any warmth. You're also going to be looking at her nipples, especially if she is a breastfeeding mother. You want to look and see if there's any bleeding or crack, dryness, because that could actually, all of those could be signs of a baby that's not latched on properly with the positioning. If the mother is not breastfeeding, you want to also make sure you're educating her on techniques as to how to keep her from stimulating her nipples so that she is not uncomfortable. So tight-fitting bra, showering with the warm water on her back, those kinds of things. So I think that's it for nips. Sorry, Kay. Yeah, that was it. So palpate for any nodules. Make sure there's nothing unusual. So as long as they're soft, they're okay. So that's breasts. Then you want to be looking at the uterus. So the uterus, you want to first palpate for the fundus. The fundus should be at the umbilicus height after birth, and then it descends 1 finger breadth or 1 centimeter per day. I think it's by 14 days that it should be non-palpable, and it should be below the pubis symphysis. Uterus. What else about uterus? If it's boggy, it could mean uterinatony, which means that's not contracting properly, which then could lead to bleeding and hemorrhage. So that is something you want to look for. Uterus. I believe that's it. I'm just gonna double check. I said everything. I did. Okay, so then the next B is bladder. Bladder, you want to make sure that the woman voids within 24 hours after birth. It's going to be a lot more than normal. It's going to be 3,000 cc's a day. You want to be checking for UTIs, make sure that there's no signs of infection, any fever, or ask her if she's having frequency in urine, any burning or irritation, or frequency. You also want to ask her if she's having difficulty urinating. Bladder, I think that's it for bladder. Yeah, and that's pretty much it. Just asking mom those questions. Then for bowels, you want to ask her if she's voided yet. You want to make sure that between 1 to 3 days after birth, she has a bowel movement. You want to be assessing for bowel sounds, auscultating for that. She should have normal bowel sounds. You also want to assess her emotional status, because if she has hemorrhoids or if she has a laceration, she could be fearful of having a bowel movement because of pain, and that could cause constipation, which could then cause more issues for the mother. So assessing for that and making sure that she is taking comfort measures such as the sitz bath. So the sitz bath is a technique to cleanse and give comfort to a hemorrhoid or a laceration by using the hung IV saline solution bag. And it's usually warm too, or cooling, so the temperature plays a part in that. What else? I should have mentioned for breasts, to kind of go back a little bit. For breasts, if they're engorged, Women can also apply ice because it will vasoconstrict the blood vessels, stopping blood flow and giving her some kind of comfort there. Okay, bowels. I think that's it for bowels. Yeah. So bubble. Lochia is next. Lochia should come in a light or scant amount. It should flow from the colors of rubra to serosa to alba. You want to make sure you're asking the mom how many pads she's going through, just to kind of get an idea of amount. Make sure that she's not going the opposite way to rubra, because that could be a sign of a hemorrhage or bleeding. Sorry, Kay, I'm saying a lot. What else about lochia? You want to make sure it's not foul smelling. It should be fleshy smelling, because if it's foul, there could be infection. I think that's it. Yeah. Okay, then it's episiotomy or perineum. So for the episiotomy, it's like, I think it's basic incisional care, so you're looking at it the same way. You want to make sure there's no signs of infection, no drainage. There's the Rita acronym, so there should be no redness, no edema, no erythema, ecchymosis, drainage, and it should be approximated. You can also use the sitz bath for that. That's how you rinse. There's the different degrees of laceration. So especially if it's a 4th degree laceration, be mindful of that, especially with the woman going to the bathroom. Again, with the fear of going to the bathroom. Episiotomy, I think that's it. Just assessing, always assessing. I think assess every 8 hours. And then, like, the different positions that might be the most comfortable is side lying and Sims. So then there's the 2 extra E's. I don't know, Kay, if they want these or not. Some were in the book, some were in the teaching, and some were not in other places. So there's also the extremities, so you want to look for DVT and pulmonary embolism. You want to use the anti-embolism stockings and ambulate. That's pretty much it for that. And then for the last E is emotional status. How are they bonding? How's the mother going through the phases? How's the mother with the family? How's the mother interacting with the baby? Is there eye contact? That kind of thing. And then that's pretty much it. I don't have anything else. I feel like I rushed through that, Kay, but I hope that's okay. This is my first time doing this. Please, please, please let me know if there is something more you need from me, or if there's a different way I should be doing this. I really am truly not sure what's expected right now, so I'd love all the feedback you can give me. So that's it. And please let me know if, I guess for the sitz bath and the ice, if you need any more information on that. I mean, you could use it for the swelling of the perineum for ice. You know, I don't know what other questions you're looking for with that. And the incisional care, like assessing every 8 hours, you know, coca-ing, looking for any drainage, measuring the amount. I'm not quite sure what else I would say. So, that's it. So thank you, Kay. I really appreciate everything you're doing for us with this weird new system. So thank you. All right. Have a wonderful rest of your day, and I will see you next Wednesday.